Welcome, everyone. We're back at you again with Unapologetically Significant. We're your hosts, Rich
Shelley
and
Marie.
Shelley Marie. How you doing today, Shelley Marie?
I am doing great.
Great.
Yeah, the weather's great. I went paddleboarding this earlier this week and that was epic. And no one was really at the lake, so we had it all to ourselves.
Paddleboarding.
I know. I'm trying a new thing
Uh,
per
So,
the usual.
so that's why you didn't answer my call.
Pretty
You said you
much.
were busy.
Yeah, no,
Okay.
I was in a meeting. Was in a meeting with the water.
Okay. Okay. Well, that works. So, why are you're all happy
I'm
and chipper?
excited to hear what Dr. Jean has to say.
Dr. G.
Yes,
Yes.
yes. So
Yes.
we have a guest today, ladies and gentlemen. So we're going to jump into some things, but I will allow you to go ahead and introduce yourself, Dr. Jean, if you don't mind.
Sure. I am Dr. Eugene Antenucci. Many hats I wear. I teach at LSU Dental School on a full-time basis. I'm a professor here. I'm responsible for mentoring students and bringing them along into the world of dentistry. But I'm also an author. I'm a clinician. I treat patients, and I'm a public speaker.
Great. Yeah, well, that's a lot of work.
Mhm.
You're a busy guy.
Yeah. Immediately, selfishly speaking, I'm like, oh, my son just graduated and he wants to be a dentist. So
Oh,
we'll have to
really?
sidebar. Yes, we will have
I
to
will be
sidebar later.
happy to speak.
Well, we have a bunch of questions today because, like as we were talking before we actually hit the air here, dentistry is one of those areas that it's a little mystic. People are somewhat reluctant, and yet it's a necessary thing.
Hmm.
And we'll get into a bunch of things today, but for the audience out there, we hit the gut and digestion pretty hard.
Yes.
We're usually honing in on that because if you mess it up in the beginning, well, there are consequences down the road, and I'm sure some tie directly into the mouth and the things that go on in there. So this is fits very well for what you do and kind of the approach that we're looking at. So why don't we just jump right in and we'll get the very general out the way first. So in terms of dentistry, how did you end up in dentistry?
So long winding road, as I'm sure most people's lives are. My dad was a physician. I always grew up thinking I'd be some sort of a healthcare provider.
Hmm.
In high school, he was an OBGYN and he was delivering babies morning, noon, night, and the next day and
Hmm.
weekends. We moved into a neighborhood. My neighbor was a dentist. He was on Saturdays washing his beautiful car, living in the same beautiful house. And I
It's
said,
always
"Wait a
the
minute,
car.
my
Mhm.
dad's like coming home at 3 in the morning and going out at 5 in the morning," and I said, "You know what?" And I worked for this gentleman, this doctor, and became interested. It became, from high school on, that's really what my goal my that's where I went. That's
Wow.
what I did, but very different. Dentistry is very different than what I had anticipated in many ways. Not only is it a business aspect, which is part of it, but it's so much
Mhm.
more than just fixing teeth and cavities and the things that you normally think of as with dentistry. And I realized that I there's a quality of life that's necessary too. And my
Hmm.
father worked. He did so much good for people, but, he it was just a different thing and not really what I was looking for, and I learned a lot about dentistry. I don't know, you know, it's more than just more than just teeth. It's more than just, fixing things. When I saw my neighbor is a dentist. I worked for him, as a janitor in his place, and I was able to
Hmm.
shadow him and follow him, and I became very interested in the dental field and in what dentistry is about. But along the way, I learned that it's more than teeth. It's more than fixing people's smiles and gums and that.
Mhm.
It's the mouth is the gateway to our bodies. Nothing gets to the gut without passing through the mouth. The
Mhm.
mouth is sort of
Mhm.
like the security checkpoint in the airport, in an airport.
Yeah.
And there's so much going on, and it's all interconnected, as is everything else, every system in our
Mhm.
body. But that's the part that's so overlooked, and that I think that people need to understand over and above anything else when it comes to their teeth and their mouths,
Mhm.
because then everything
Right.
falls into place.
Yeah. Yeah.
Do you
Right.
find like a commonality with people that just have a fear of dentists or going to the dentist? Is there like a common reason why?
Uh, and I don't think it can be generalized. Some people may
Mhm.
have had bad experiences in the past as a
Mhm.
child. They may have had, too many cavities that they had to be dealt with, and their practitioner was not the most kind or gentle person in their mind. But as you know, I mean, if you have children, if you have animals, you know that their personalities are all different, and one can be
Right.
skittish, and so that's interplay. There's no real
Mhm.
general answer.
Yeah.
I know that in my experience, I can manage and deal with maybe 85% of people,
Mhm.
with the best of skills, but, there's some people that are they're out of my ability to, with children or even
Right.
adults, to calm
Mhm.
down,
Right.
regardless of everything that I think I know or that I do know.
Yeah.
Mhm.
So, there's no easy answer,
Mhm.
um, and for some people, it's a really difficult thing. It's
Yeah.
I teach at a school, and I practice at a school, and you would be horrified to see what I see, because people haven't
Mhm.
Mhm.
been to a
Wow.
practitioner because of fear,
Right.
money fear
Right.
are the 2 major things,
Mhm.
for 40 years.
Wow.
It's
Wow.
it's crazy,
You
crazy.
know, listening to you talk took me back to I don't know, I must have been 6, 7 years old, some 8, somewhere in there.
Mhm.
And my mother was a nurse, and she took me to the dentist, and I used to be into a lot of candy back then.
Mhm.
Mhm.
And we go to the dentist, and he goes, "Hey, you've got 4 cavities." And so right away, my mother turns to the dentist, and she's like, I've been telling this kid to stop eating all that candy and to brush his teeth and blah, blah, blah. I want you to fill them and don't use any Novocaine."
Mm.
And he
Oh,
did.
Wow.
so I
You
bet
talk about trauma.
I
Yeah.
bet you look forward to going to the dentist every time you go.
Never had a cavity since. It
Really?
worked.
That was hard love.
Yeah, yeah,
Wow, that was
really.
hardcore. Yeah,
Yeah.
your mom was not playing games.
She didn't play games. So,
But that's funny because it kind of brings me to a question of like you led with the mouth is the gateway, and we always talk about nutrition and all this good stuff. So let's talk about microbiome, like the oral
Okay.
microbiome and how that links to
the gut.
the gut microbiome.
Well, you maybe you know, but I was just flabbergasted when I learned that there were over 700 different species of bacteria that reside in the mouth, that can be
Mhm.
at any given time. And if you look at individual bacterium, there's 20 to 100 billion with a B in the mouth. That's a heck of a lot of
Yeah.
That's
bugs
a
that are
lot of little
running around.
aliens up in there.
So the body's design, it's just the most magnificent creation that exists, because the design is that this dirty space of the mouth that has to deal with the environment outside is a barrier to coming into the rest of our body, and that it all actually we're alive, despite that
Mhm.
many
Mhm.
bacteria in our mouth. So, and not all of the 700 different species are bad, but when there's disease, there's more bad than good, or even a few bad become bad, because they not only enter into a body through normal means, through, down the gut, but they also enter through leaky membranes in the mouth, through bleeding gums when you have gum
Mm.
disease,
Mhm.
The bacteria that's in the gum disease is known to be detrimental to uh, the heart, to the circulatory system, to the brain. There's connections. There's a recent Finnish study that talked about the correlation between oral bacteria and bacterial disease in the mouth, disease in the mouth from bacteria, and dementia and cognitive decline
Mm,
in later years. And there's a strong correlation. So the mouth has to protect us from the outside environment, and it does it because it has such a powerfully strong blood flow. Where there's a little problem, the cells race to that area and do all the things they do to identify, isolate, repair, and regenerate, so that there's no invasion. But
mm,
when these
Mhm.
systems break down, and they break down from for all different reasons. It can be from systemic reasons that you have systemic conditions like diabetes, or you have an autoimmune condition or whatever,
Mhm.
or they can be from conditions that we impose on ourselves, like we smoke a lot, we smoke, and we drink too much alcohol, and we eat the wrong foods, too many sugars that cause inflammation, and all of these things. And
Mhm.
you could have a double attack from a leaky mouth and a bad system, and then you have a setup for big problems.
mm,
Yeah.
So the mouth is it's not to be taken for granted. It's connected to all of our health. Um,
Mhm.
know that inflammation is a big problem. Inflammation is the source of so many issues that we deal with, and our body is inflammation's good because our body's fighting something, but when
Right.
it's out of control or chronic, it's not good.
Mhm.
And upstream inflammation not from the source of an issue, but from somewhere else, adds to the body's load. And the mouth is, unfortunately, an unhealthy mouth is a source of upstream inflammation throughout the body that is chronic and doesn't allow other things to heal.
mm,
So
Mhm.
keeping the mouth healthy is paramount. That's a reason, a whole body health reason, not just to fix a tooth that hurts, but it's a whole body health reason to keep your mouth healthy.
Yeah.
yeah.
And speaking of a healthy mouth, what are some of the things people can do? Because people do all kinds of things, you know? You got brushing, you got flossing, you got like the water jets, you've got scraping of the tongue, you got
Right?
people that all kinds of oral rinses. And I look at some of those labels and I'm like, oh my God, I'd never put this
Yeah.
in my mouth.
Yeah.
Well, we there's basic things to do. We're at a disadvantage because we're so dependent on the marketing that inundates us to push us in different directions, that this product, that product. It's principles that are important. The principles are, you have bacteria that are normal, but when there's too many of them, you gotta get rid of them. And the way to get rid of them is to brush,
Hmm.
to just physically brush them off, to floss, or to use something in between teeth to get them in
Hmm.
between hiding spaces, to cleanse the tongue, which is, if you've ever seen, I don't know if you've ever wanted to see or seen a tongue under magnification, it looks like these tentacles that are swimming like this. It's just the entire field of the microscope, and those projections of villi on the tongue are hiding places for bacteria. So they're like filaments, and
Hmm.
and there's reasons that we have them, but they also hide bacteria. And so tongue scraping is a very important part of it. There
Okay.
are practices like oil pulling. There are different oils that are like coconut oil has
Hmm.
lauric acid, which is antibacterial in nature, and that helps to not only discombobulate the cells or just break down the bacteria, but also the oils end up sticking to these materials and help make it
Hmm.
easier to get rid of them. So,
Okay.
processes like oil pulling,
Mm,
my dad was born in Italy. I grew up culturally Italian, and, we use olive oil. It was just a part
mhm,
Okay.
uh, of, uh, of, folk medicine or just passed down medicine, and
Mhm.
why
Mhm.
olive oil is full of polyphenols, which are in and of themselves anti-inflammatory, antibacterial, and the oils do the same thing. It might not taste as good as to an
Right.
Italian. It's great, but it might not taste as good as coconut oil, but it has the same effect. And you go to Greece, you go to Italy, Mediterranean countries, that's it's the same practices, but it's the principles that are important. It's keep the mouth clean. It's not any product, it's not any special toothpaste. Um, it's the whole package.
Mhm.
As you get into health and as you start to look at what can I do better than what I'm doing? Then you start looking at the types of toothpaste that you use, the types of brushes that you use, the techniques that you use in cleansing your tongue, and how long you swish, or what you use in terms of oils or in terms of cleansing agents in your mouth. But it's the principles that are important. The principles are get rid of the damn bacteria that doesn't belong there.
Mhm.
If
Yeah.
you
Yeah.
I
spit
have
out and
never
just
heard about using olive oil before, so thank you for that because we
no,
always have
it's
olive oil.
you go. I learned that first, years ago when I went to an olive grove, they had 3,000-year-old olive trees that were still producing in this place in Puglia, and
Wow,
that
that's
was just
amazing.
unbelievable. But, they put down 4 different oils to taste in little shot glasses. And I was saying, "Drink
Mhm.
olive oil? Crazy?" No, and they go, "Do this all the time. You swish it around, let it coat your mouth, and then you swallow it because there's a health benefit of swallowing the olive
Mhm.
oil. It's followed by, with that process, it's not followed by brushing, but if it's a part of a health routine, of a home care routine for your mouth, you do your brushing, you cleanse your tongue, you do your
Mhm.
brushing, oil pull, and then follow with water. Um, and I always learned warm water was better for digestion. That's how I grew up, and
Mhm.
Mhm.
that's what I do.
Right.
It's part of so you start to look at, and then you start to look at the toothpaste. Do you want toothpaste that have manufactured detergents in them, or do you want something that's more organic? And
Mhm.
you start going up a ladder in terms of how you do it, but start off with just get the junk out of your mouth is what it comes down
Yeah.
to.
Mhm. Mhm.
Oh, that leads to your question with fluoride.
Fluoride, I know it's a big dot deal, and I get people that ask me, like, "What's the bad thing about fluoride? Should we do it? Should we not?" So we're gonna ask the professional on this one. Dr.
Well,
Jane, what are your
there
thoughts?
there's the 2 side we were talking before about what are the studies, so
Mhm.
with
Mhm.
here in the state of Louisiana, there was this big commotion about the legislatures saying no fluoride, the ADA has to fight it. The ADA is super, super fluoride. Fluoride has its benefits. It is
Mhm.
anti-carcinogenic. It does strengthen the enamel of the teeth. It strengthens, that's part of what the way it binds and the way the chemistry works. There are studies and there is a good amount of data of negative health effects of it, and especially from excess fluoride. Now,
Mhm.
fluoride is natural in our environment. There are communities where, I think, the stuff we learned in school was that there was this in the Western United States, there was a mountain where Indians lived. One side had fluoride in the rocks, the other didn't, and they noticed heavy dental disease on one side, none on the other side. And they said, let's study this fluoride thing. Fluoride has benefits, but fluoride, as any other substance, has its negatives. And I don't have a clean answer for you.
Mhm.
Mhm.
I don't I don't have a problem with small amounts of fluoride, but I don't, like prescribing fluoride pills for young people. I like looking at
Mhm.
dietary. I like looking at,
Mhm.
uh, the fact that you can do the same things with proper care.
Mhm.
Right.
It's not a magic pill. That doesn't
Mhm.
just protect you. In excess, it causes lots of problems that I see and deal with, and that's when
Mhm.
people ingest too much. The
Yeah.
long-term health effects, I don't know.
Mhm.
I
Now
don't
you
know.
just mentioned something about sometimes you like to deal with it with nutrition. What does that look like? And
My view toward
I know every patient's gonna be different, but just kinda in general, when you see something.
well when it comes down to the same things that we speak of all the time with nutrition. I'm looking at eating a plant forward diet,
Mhm.
concentrating on whole foods and vegetables, not processed, not filled with salt, but use the vegetable and a variety of colors is what I grew up with. It's what I learned and it's what I do. We as human beings grew, we evolved over time. We didn't just happen. We evolved, and we
Mhm.
evolved within certain areas with certain cultures that back up the nutrition that we have. But that nutrition all supported this magnificent being that we are. And it involved not processed foods in the least. It involved natural
Mhm.
foods, mostly carbohydrates, but complex carbohydrates, which is
Mhm.
what our ancient ancestors ate. And they also ate meat. So I'm not anti-meat. However, if with the proper mix of vegetables, you can do a non-meat diet. But meats were a big part of our ancestral origin and is part of our
Mhm.
DNA. The proteins are there, so I look at whole foods, I look at sourcing foods as being important, and
Mhm.
my view is that if I am eating a variety of fresh vegetables and cooking them properly, not overcooking them, not adding
Mhm.
too much junk to them, then that's what my body needs. I don't need to
Mhm.
do any more. It's when that so the nutrition is already there. I take very few supplements. I don't. I'm
Mhm.
68 years old. I follow the same types of things that I actually grew up with, and it's serving me, knock on wood, to this date well.
Mhm.
But
Good.
that's how I view it. So if you eat a variety of vegetables, you're getting all of the vitamins that you need. If they are organically grown, they're grown in good soil that's not been overmanaged, and that
Right.
soil is a
Mhm.
part of those vegetables, which is now a part of our body. And if you're eating animal meat and animal proteins that are sourced properly, they're eating food and grain that's of the same nature.
Mhm.
It's all connected.
Mhm.
Right. Right. Um, let's talk about, because I've had a lot of questions around this. When a person actually has, say, gingivitis,
Yes.
and that's something that I think is a surprise to a lot of people. They don't know they have it. They go in, they find out that they got an issue with it, and then if left untreated, I mean, it can get pretty bad.
Mhm.
And I know a couple of people that, they're like, they had to go to a specialist and they want to do skin grafts and, they've had bone loss. So a person that's either entering that stage, in that stage, do they have a lot of options? Because a lot of these people want to go, what can I do more holistically than a graph or this or that?
Well,
Uh,
no, that's a very very good question because it's not an even playing field to start with. Some people have a genetic or familial disposition towards gum issues and gum problems. So
mhm,
you're at a detriment to start with, and those are the cards you were dealt. So from that point, there are stages. So there are some people, gum disease isn't a part of their lives.
mhm,
Um, but if there are stages of it, which starts with gingivitis is just inflammation of the gum tissue.
mhm,
It's inflamed by something. What's it inflamed by? It's inflamed by bacteria. It's also inflamed by hard material that stick to teeth. Some people
Mhm.
develop a lot of calculus or tartar, or
mhm.
um, think of them as barnacles on the side of a ship. They're just stuck to the teeth, and you
Yeah.
can't brush them away. I grow calculus like crazy. So every 3 to 4 to 6 months, I need a good cleaning. Some
Mhm,
people, every year they do, but so there's the bacteria in the calculus, bacteria in plaque, which is
Mhm.
softer material, that is the bacterial colonies that are feeding on all the sugars that are in our mouth.
mhm,
When they get out of hand, they cause they have byproducts. They have waste products. Their waste products are acidic in nature. They're toxic to human
Wow.
tissue, And the
Mhm.
human tissue, when it says, we got this toxic stuff flowing down, we have to fight it. So it fights it by rushing blood to the area to prevent it. If you think of a tooth is in the bone,
Mhm.
and the outside environment is there. So there's no real stop like skin on our bodies to
Mhm.
prevent stuff from bacteria from getting into our inner tissues. In the mouth is just a cuff of tissue around the tooth that's held by fibers. So when that
Mhm.
system gets overloaded, then there's leakage from there into the inner sanctum of our bodies. It goes into the
Wow.
Okay.
bloodstream. So that's why it's bad health-wise, but it's there because the body is fighting an invasion. So it
Mhm.
builds up blood in the tissues. When you brush your teeth, if you spit out when you're spitting out from brushing and you see little tinges of blood, it's not normal. We normalize it
Mhm.
because we say, "Yeah, it's no big deal." You know, if it's gushing, then you say, "Oh, that's a big deal." But if it's just a
Right.
little
Right.
tinge, it means there's some inflammation that's present that's not normal because it shouldn't. If you rub your skin, it doesn't start to bleed. If you rub your
Mhm.
gums that are healthy, it doesn't bleed. If you rub your gums that are not healthy and there's blood, it means you have a little extra inflammation that could be from trauma. Maybe you were eating pizza that was too hot and it burned your gums, and it's just
Mhm.
healing
Mhm.
from that. Maybe you bit on a hard, chicken bone and it scraped your gums and it's bleeding because of that. But chronic bleeding like that means that
Mhm.
there's fighting something. So how do you get
Mhm.
rid of it? You brush, you floss, you oil pull, you cleanse your tongue, you keep the bacterial load as low as possible. There's no
Okay.
magic. There's no
No.
Okay.
The magic
no.
is the repetition and the
Yeah.
and being
Consistency.
proactive and be
Yeah.
and the
Yes.
consistency of all
Now
of the things.
now you can brush and do all that you want, but if you have tartar or calculus or calcified material sticking to your teeth,
Mhm.
and it happens and it goes under the gum where you first of all, you can't brush it off. So you
Right.
need
Mhm.
someone to do it, or you need to go buy a device and learn how to do it yourself, which I don't really recommend. But go to a professional to clean your teeth. Um,
Mhm.
if you have a dog, you bring your dog to do that,
Right.
and you spend 15 times more than what you're gonna spend on yourself. If you
Right.
put
That's for
a lot of
sure.
teeth in the whole thing, do it. That's what it comes out. If you have to do it every 2 I have some patients every 2 months they have to come in. But just
Yeah.
get that stuff off because that is like a sponge, a hard sponge harboring bacteria.
Okay.
So,
Mhm.
those are the simple things. But then as that progresses or if it goes unchecked, the inflammation extends past the gums and your teeth are suspended in bone by like a hammock string that are really
Mhm.
tight. They're
Mhm.
ligaments. As they get inflamed, they kinda zip away and they kinda go down, and then the gum and the bone follows that. So that's where spaces happen or pockets. That's what you hear with gum disease. You have pockets
Mhm.
of
Mhm.
4
Right.
millimeters, 5 millimeters. We can't clean with a toothbrush beyond 3 millimeters. The average person can't. So 3 millimeters is like uh, I don't even know, 3 millimeters. It's
Yeah.
a small amount, but it's in for bacteria, it's a huge chasm. So if it's 4, 5, 6, now you have a cesspool that's
Mhm.
Yeah,
collecting, and
that's
that cesspool has bacteria in it of all different types that are now going into your bloodstream. They're they're coming into your breath, so your breath smells funky.
Mhm.
It's got certain odors. I know exactly when I could be in an elevator and I say, "That person has gum disease." I know it because smell. It's different than gut smell. It's different
Mhm.
Right.
than if you had too much to drink last night smell. It's
Mhm.
it's bacteria in your in so those bacteria are hard to remove at that point, and that's why people
Mhm.
get their gums
Mhm.
surgery. They get their gums
Right.
cut or they get things moved around or grafting or whatever to
Mhm.
Right.
to
Right.
change the environment. You don't wanna get to that point.
Yeah.
You wanna keep it in the 3 millimeter range or the healthy range.
Mhm.
Be
So
What
aggressive.
about perio trays? I've heard a couple of people mention those, and I did a little bit of research on them, and again, half say
Tra
it's good, half say it's not good.
a medicament to put medicaments in?
Yes.
Tra
Uh-huh.
yes, yes, it's helpful, if you're at that stage. The thing is to not get to that stage,
Mm,
and it depends on what you're putting in there. So um, if you're putting antibiotic low dose antibiotics in there,
Mhm.
there
Mhm.
is a technique. Instead of using trays, we use it's like almost like a cord that gets put under the gum, and it just emits antibiotics, on a regular basis. Now you have
Mhm.
antibiotics in your body, which is
Yeah.
not a thing.
yeah.
Um,
Right.
Trays carry fluoride. Do you want excess fluoride seeping? So there's all different depends on what the medicament is,
Yeah.
but
Yeah.
you can deliver the same type of, again, it depends on the severity of what you have, but you can deliver the same type of medication with get a little syringe,
Mhm.
a needle syringe, but an aspirating syringe, kind of like a
Right.
squirt gun, and
Uh-huh.
just fill it with, warm saline or fill it with an oil, and just irrigate your gums before you brush
Okay.
and then you brush.
Mm.
Okay.
So we're at
The
back to
commercial
your
mouthwashes are not really I don't really put faith in them. They have a purpose, but many of them contain alcohol, which is detrimental on a regular basis also. It has,
mm.
Mhm.
not only cellular effects, but the whole body. Some people can't tolerate excess alcohol. It does they just shouldn't be doing that. Um, there
So,
are
Dr. D, let me
and
ask you this. So you're
Mhm,
mentioning the alcohol in the over the counter mouthwash products. What about
yes.
like alcohol, like drinking alcohol? Does it have the same effect or can it have the
Well,
same effect?
it is alcohol is a toxin to the body, and there are many different views on alcohol. If you study, about the blue zones and you study them,
Hmm.
there's alcohol in 4 of the 5 blue zones, alcohol is a regular part of ritual and of life. In Italy, no problem having a few glasses of wine with dinner, and the centenarians they're drinking alcohol all their lives. In Greece, the same thing. In Spain, it's a part of culture, it's a part of life. Um, it's when alcohol is in excess, and what excess is, debatable to different people,
Hmm.
but, 2 to 3 glasses of wine on a daily basis, I have no issue with. And there are some
Mhm.
people that will tell you from a health standpoint, you should have no alcohol whatsoever.
Hmm.
I think that the experience and the observation of the blue zone areas, which have the most people living over 100 than anywhere else in the world, show that alcohol doesn't seem to have that much of an effect. So that's
Yeah.
my common sense approach towards it. But
Yeah.
Hmm.
there are studies and literature on both sides of the coin of saying
Right.
moderation to
Hmm.
nothing.
Yeah. I think,
I'm in the
lifestyle.
couple of glasses of wine a day
Yeah.
category.
I think lifestyle, obviously plays a huge factor in that
Of
because,
course.
if you have a healthy diet and you're getting some exercise and sleep, all the stuff that we were told when we were kids, um, I think there is it has a less effect on people. And for folks who are, all the processed foods and this and that, I mean, they just, I
Mhm.
mean, their systems are not conditioned
Sure.
to be able to handle it. And so,
And you're putting yourself at a detriment to start because the processed foods, they're filled with chemistry, preservatives, you whatnot, affects your gut, which affects the way your body responds to everything. It affects the inflammatory response throughout just about every aspect of your body, and you're not as capable of dealing with the toxicity,
Hmm.
of the quote unquote toxicity of alcohol or anything
mhm,
else that you put into your mouth. So if
yeah,
you're a heavy
yeah,
smoker and you're a drinker, there's a very high likelihood that you're gonna get an oral cancer. That's
mm,
just fact. I
Hmm.
mean, that's
yeah,
the percentages are very, very high of the 2 in combination. and one without the other also, the percentages are high.
Right.
So it's true, your lifestyle has a big part of it.
Mm,
If you're sedentary and obese, um, I don't know of studies that say it, but I would say that you're probably, um, shouldn't be drinking more than less alcohol. You'd probably be better off if you didn't have any. Uh,
mm,
Mhm.
and as Americans, again, I grew up as the son of an immigrant and with my feet in both worlds, in Italy and in here. But I realize that American culture is it's a culture. It's a hack culture. We're looking for the pill. We're looking for the
mm.
the
Mhm.
The quick
formula. We're
fix.
looking for the guru to follow, or there's it, and we need an answer because
Mm,
I think American culture. Um, I'll make the statement, is looking for culture. It's got a culture,
Mhm.
but the culture is a mishmash of it's an amalgamation of so many things where there's so many old not older knowledge, ancient knowledge that hasn't been passed on. So if
Mhm.
you live in Greece and you live on an island, your grandma or your yaya, as they say, would be learning from her grandma, and they're using the medicaments and they're eating bees, honey, and wax and things, and they're doing things that they've done forever, and it's keeping their
Right.
bodies healthy. And the
Mhm.
same here, we're looking for answers and for pills and for formula. And the formula is really pretty simple.
mhm,
It's
Mhm.
move your body more than you don't move it. Eat the right
mhm.
stuff. Be surrounded by people who nurture you and who love you and believe in something other than yourself. I mean, that's
Yeah.
really what
I
secrets
think
are.
sometimes what we look at is like, "Oh, that's too simple. That's too simple. It's too easy.
Yeah.
I need something a little bit," we wanna make it difficult because we believe that, if you work really hard,
Yeah.
is it's worth it.
Yeah.
You have to sweat, you have to be in pain. I'm like, "Well, no, that's a choice." Like, it doesn't have to be
Why
that
do I have to
hard.
change my diet? I could just inject myself and I'll be fine. And in a couple of months,
Exactly, like
I'll be with the movie stars and that's it.
Right.
Yeah, but there's
Interesting.
something lost along the way with that.
it
Yeah.
does,
It
very much
is.
so.
Where do you see, integrative dentistry headed next few years?
Well, it's a tough road. I could see where I want to see it. I don't know if it'll be
Mm,
there, but integrative dentistry would incorporate the medical community as well as the dental community in looking at whole body health and looking at the
mm,
mouth as the things we were talking about before and viewing the mouth as the gateway to whole body health and that the
Mhm.
interconnectedness of what goes on here with everywhere else. So that I would see it when a person goes to a physician who's really doing their job in terms of trying to understand their patient, that the physician is recognizing oral disease and is sending that individual to a dentist who understands and who will treat that from the same perspective. So
mhm,
Mhm.
that's how I view integrative dentistry and looking at at, at the the oral cavity not as a distinct part or as a mechanic's job where I'm just fixing the engine, but I'm fixing the
Right.
whole car. I'm doing the whole
mhm,
I'm responsible for the whole thing. When
Right.
I when I when I see a patient, I am cataloging just in the interview, just in the short period of time when I speak to them, everything about them. I could tell a lot. I could tell from their, if they're sitting like this and they're not looking at me and they're, while they're talking, it's different than if they're engaging with me. So I have
mm,
an idea of them. I could tell by what they're wearing. I could tell by their complexion, the way that they care for themselves. And then I look in their mouth and if, I could tell right away, or not right away, but often they have diabetes, if they're obese or if
mm,
I could guess that they have hypertension, I could guess that they have metabolic diseases, and I would look at
Mhm.
that and I could guess and understand the types of things. So integrative dentistry would take into these things into account and not just look to fix a cavity or to give you 10 veneers so that you can have a beautiful, perfect smile,
mhm.
but to go beyond that to make your mouth healthy and then make the
Mhm.
smile.
Nice.
Okay. Oh, good. Any, uh,
No,
any
this
other
is
thing?
extremely informative. I think everybody's gonna walk away, including with us, with some golden nugget of,
I
some
hope
of
so.
the yeah, no, it's for sure. For sure. There's no hoping. There's for sure somebody's gonna
We'll
walk
be
away.
inundated with questions,
Yeah,
I know.
we will get a ton of questions, and we'll shoot those over to you if we can't.
Yeah, shoot
We
them
might
over to me. I'm really I'm always happy to, engage with people.
well, thank you for that. We appreciate it.
Yes,
You got
yes.
anything?
No, during the conversation, all the notes I had down here, they're all been answered, and
Good.
looking forward to putting this out and getting, getting the feedback, which I know will be great. So we appreciate you taking time out of your busy schedule to be on the show today, and hopefully down the road, perhaps we can have you back and
Love
dive
to.
into some other areas. But we do appreciate it.
Yep.
Now I noticed you got a number of books out on Amazon.
Yes,
Are
well,
they
I, I had begun my writing career just for dentistry, but I've gone into different areas, and I wrote, 3 self-published books several years ago, but a publisher, Brick Tower Press, has asked me to unpublish them, to rework them, retitle them, and they will be coming out in July, a 3-volume set on longevity, health, wellness, um, starting with the Italian perspective of health and wellness, and then going into what we need to do on a daily basis, a big picture of it, and then looking at the
okay?
science of longevity. So these 3 books are coming out in July,
All
middle of July.
right,
So a couple months.
perfect,
Yep.
perfect. All right,
So we definitely need to have a follow-up.
yeah,
Absolutely.
definitely, definitely, yeah.
Send you
Uh,
I'll send you a copy of them.
Great. You know, yeah, this is exciting. I look the subject matter you just mentioned. Oh, I love it. I
Yeah.
love it, and it needs to be out there. People need to know, and because you can effectively make a change in yourself, and when you change yourself, you can help others. You can't change anybody,
Yep.
but you can help others understand how they can change themselves. So again, appreciate that. I'm looking forward to that book.
Yeah,
That's
same.
going to be amazing, and I'll probably have you back to talk about it.
Yeah.
So,
Well, thank you
well,
much. It was my pleasure being here.
we thank you, and to all the listeners out there. We'll be cutting up the podcast probably in the next day or two, and have some other shorts out there. But Um, definitely tune in, subscribe to us. We appreciate all the comments and all the followers. So, with that, we'll make it a wrap.
Yeah.
And
Till next time.
until next time, we'll see you.
Toodaloo.
Take care.
Bye-bye. Thank you. Bye.